So what is tardive dyskinesia?
Tardive dyskinesia is an abnormal movement disorder that can occur as a consequence of different kinds of medications. Usually those medications are antipsychotics. So antipsychotic medications, there's two different classes. There's the older, what we call first generation antipsychotics, and the newer second generation antipsychotics. And those older medications like haloperidol are more likely to cause this movement disorder than the newer medications are, but both can. And it essentially what it manifests as are these involuntary abnormal movements, like it might be kind of jerking movements of the face or the mouth or the shoulders, semi-rhythmic movements, but they're movements that the person has no control over.
And who's at risk for this disease?
So the people that are at the highest risk are people who are taking antipsychotic medication. But the risk can be amplified in people that are older, in people that have co-occurring substance use disorders, and in people that have other sorts of problems with their brain, such as if they've had a traumatic brain injury, a stroke, or if they have intellectual disability.
And can you discuss and maybe demonstrate some of the symptoms?
Sure. So some of the more common symptoms involve the mouth and the face. So it might be things like involuntary smacking of the lips, or like the tongue darting out of the mouth, grimacing, kind of repetitive grimacing, and then sometimes bigger movements that involve the shoulders or the trunk. So for example, sort of like an involuntary twisting, kind of a repetitive shaking. And then you can see fine movements of the hands, like a pill rolling tremor.
And how is TD diagnosed?
So it's diagnosed clinically. Any physician can diagnose it. And there's actually a scale that can be used to help determine sort of the severity and the extent of the problem. And it's called the Abnormal Involuntary Movement Scale, or the AIMS. And anybody can Google it and find it online and take a look at what all the criteria are. But it covers all of the different types of body movements that can be impacted by TD, as well as how sort of distressing or impairing it is to the person who's experiencing it.
And is there any specific treatment for it?
So there are some treatments. The unfortunate news is that tardive dyskinesia can be irreversible. But the first step in treatment would be working with your doctor to either reduce the dose of the antipsychotic medication that you're on that's causing the symptoms, stopping that medication, or maybe switching to a different medication that's less likely to cause it. And then there are some medicines that are usually prescribed by a neurologist who specializes in movement disorders. That would be medications like valbenazine or deutetrabenazine. These medicines can really help with the symptoms. The most common side effect is fatigue.
Thank you.